Okay, hello. It's Nicholas, and chest update. I'm wearing these thingies on it. Um, these are silicone strips. Uh, I'm 3 months post-op. In a couple days. But I'll take these off. I'm just gonna take them off of one side, but because it kind of hurts because like there's hair starting to grow over here. Ugh. But anyways, yeah, I'm 3 months post-op with Dr. Zinsser in Richmond, Virginia, and I would say that overall, I'm not. I don't hate the results, but I'm not completely satisfied, to be honest. Which is really disappointing because it's permanent and it's on my chest. But I'm trying to not be too upset. Because what am I going to do now? Like, I made the decision to go to him, and that was my own choice. It's my own fault, blah, blah, blah. I personally wanted to go to Dr. Madali in Ohio, but I was so eager to get it done. And with the money that I had, I could only afford to stay in my area. And so, um, I, yeah, decided to just go with him. I thought his results looked like they'd be pretty good. Like, I thought the only difference really would be, like, just the shape of these, incisions and stuff like that from what it looked like. But it ended up that, I don't know. I mean, I'll talk about it in a second, but, like, basically, if I could go back in time, I definitely would have gone to Dr. Madali. I wouldn't say I hate my results. Like, they're not awful, but there's just, like, I, I think at this point it's safe to say that anything that's left over in my chest is not swelling anymore. I think it's fat still, which makes me really mad. As you can see here, there's kind of like a little bit of a dog ear type thing happening. Like he didn't get all the breast tissue from my side. There's not like a cleavage thing happening really, which is good. But I think that I see. This is the thing is I can't really tell if it's just because like I'm kind of like I wouldn't say I'm chubby, but I'm like a little soft around the edges, you know. So I can't tell if the softness on my chest is just like regular fat or if it's leftover breast tissue. So what I was thinking was that I would give it a like I don't know a year, whatever, work out and like build the muscle underneath the way I want to, and then see if there's any like pudginess left still, and then unfortunately get a revision. Whether that be that they liposuction, that I go back and he liposuctions the rest out or whatever, I don't really know. But this incision on this side, see this one's not, and that's why I decided to just leave this tape on this side because like that side is normal looking, like most incisions and stuff. But this side, as you can see, is hypertrophic. See how it's like risen? I don't know if you can tell, but it's like risen and really there's a lot of scar tissue built up, which isn't because of the surgeon. It's because of the way that my skin healed from the tension and just he said it happens to like an unfortunate like 20% of people maybe. So that was me. I don't know why it's only on one side, but basically it's just kind of like itchy and painful around the incision. Like this side really isn't at all. Like it feels really normal and fine. Like I can stretch my arms up and it's a little tight around the incision, but it doesn't hurt at all or anything like that. But this side, if I like lay on it sometimes in the wrong way, then the incision hurts. It's usually really itchy right here. I don't know why it is right here in particular, but it is. So yeah, and there's kind of also a little bit of hypertrophic scarring around my nipples too. I think it's called hypertrophic. I hope that's what the word is, but Yeah, which isn't bad. Like this, I think will go down. I've been, of course, massaging my chest almost every day and stuff like that. But yeah, I don't know. I mean, I'm happy. Like my chest is, I'm comfortable enough that I can like not wear a shirt and not be worried about it. Blah blah. But I'm not really sure that all the tissue is out, which, like I said, is really irritating. And I could be wrong. I don't. I mean, I don't really know. I'm gonna go see him, like, the surgeon again, in November, and at that point, I don't know. He should be able to tell me for sure whether it's swelling or tissue. Um, I've been trying to like massage it out in case it is swelling, but I don't even know if it is. But I don't know. Just like I'm just kind of mad. I think it's tissue, but so what's gonna happen is I guess like in a couple years or whatever, whenever I can afford it, after I've gotten, I think the more important thing that I need to do now is focus on saving money for a hysterectomy. I don't know why that was so hard for me to remember. Save money for a hysterectomy, but if, yeah, like somewhere down the road, I'm gonna have to get this revised. I think probably, which is really annoying because I thought, paying $7,000 the first time would be enough to get good surgery, but I guess not. But like I said, it's my own fault for choosing him when I guess I should have known. Like he's not done. I mean, Dr. Zinsser has done a lot of FTM top surgeries, but not a ton. He's not as experienced as a lot of other doctors are. So my suggestion to anyone is really like try not to I mean, I know that it's hard to have a chest when you don't want one, and like I understand that sometimes like you just feel like you just like need to get it done no matter what it takes. But really, I don't know. If I could go back and tell myself anything, it would be you've lived with this chest for 7 years and you've never wanted it. What's another couple of months or whatever? Like, go to the doctor that you want to go to. Don't settle for the closest or whatever, the cheapest. Like, go to the doctor you want to do your chest. Yeah, and I really like Dr. Madali's because they all looked really good and consistent in a certain way, but also like kind of personalized to the person's body. Like it looked, all of his like works don't look exactly the same, but they're consistent in a certain way. Like I don't know how to explain it, but yeah, if I could go back, I'd totally go to him. And yeah, and I wouldn't say that I'm like super duper upset with my chest. Like it looks pretty good, IMO. And like I said, I feel comfortable like taking my shirt off and going out in public. I think my nipples look really good. But yeah, I don't think that I would redo it if given the chance. So, and I'm like trying really hard not to like let it bring me down or whatever, and like not to worry about it so much. Like it's enough that I pass, it looks good. If I build my chest muscles, it probably will look even better. But I don't know. And the thing is I already like kind of have some chest muscle. Like I mean, not a lot, whatever. But like that's like this is muscle. There's no tissue like over that. Any of this. I just kind of naturally like already had some chest muscle there, so I just don't know. I don't know. In the places where like my muscle is really, I don't really know. I don't really know what I'm trying to say right now. But anyways, Also with the hypertrophic scar, he said that there's a possibility that I'll have to get it if when I go back to see him, like in November, it doesn't look like it's gotten much better. He said he probably will want to cut it out and restitch it, and because there won't be any tension, because he won't have, and not be cutting out like another chunk of my skin, he'll just be like yeah, stitching like this much to get like this much space together instead of like this much space, essentially. That it shouldn't happen again. It shouldn't be hypertrophic. It should heal the way that this one did. So that would be cool, but then I have to pay for anesthesia and for the hospital fees and all that kind of stuff. So that's really annoying. But which is why I think I might just wait and then go to a different surgeon down the road. And if this is still a problem in a couple years or whatever, get that fixed, and maybe they'll be able to do like keyhole or something with my chest and get the rest of the tissue out if there's tissue left, because I can't tell, cause I don't know, because I'm not a surgeon. But I don't know. I'm just gonna like work out and see if this changes and figure out what to do from there. But yes, I'm not saying I don't recommend Dr. Zinsser. I'm just saying these are my results. I had a B cup to start with. I think it was a B cup. It was something around there. Yeah, it was probably definitely a B cup. And yeah, I mean, my chest looks good, but it's not really what I wanted for me personally. I would just do your research and go see him and look at his results and all that kind of good stuff. So